Sheltering Arms works to enhance the lives of those experiencing physical disabilities and illness. With a full range of rehab and wellness services, Sheltering Arms strives to stay ahead of emerging technology in order to provide their patients with innovative care. Joining us this morning is President and CEO Mary Zweifel. Thanks for joining us.
Thank you for having me.
It's excellent to have you with us. You guys have a lot going on. It's safe to say Sheltering Arms is moving and shaking.
We are, that's for sure.
You're ahead of a big week coming up on Active Aging Week. That's the week of the 25th here in September. But before we get to that, we kind of gave an overview of the mission, but in a more approachable way, what is it Sheltering Arms does?
Well, we provide rehabilitation, physical rehabilitation services to people who require inpatient services, outpatient services, we have recreation services, we have fitness services. We really provide the full continuum of care for individuals.
Are folks referred by doctors? Are they, can they make the decision, I need some support, I need to come in and explore services?
Right, right. Typically they'll have that conversation with their physician. They all have the right to choose whatever physical rehabilitation service they would like. In our fitness programs, they don't need a physician referral. They can become a member of one of our centers. Inpatient, we do require physician referral. Outpatient, we require physician referrals as well.
You have multiple locations and you've been in this community a long time. Things are always evolving.
Right, right. They are, and we stay cutting edge. We've got the most advanced technology under one roof, I think, anywhere in the region. Our advanced technology provides, like I said, cutting edge treatment to individuals who require to learn to walk, to learn to use their arm again. What we found is this technology is related to research, and the research shows that early mobilization after patients have had a stroke, for example, getting them to move in a repetition such as a walking fashion really helps them recover sooner and helps that recovery stay sustainable. So we've got some really good data that shows that patients who discharge from our programs have reduced readmission rates back into acute care facilities.
So as the research increases, as the data comes in, you're able to respond with technology that helps outcomes in so many ways.
Absolutely, absolutely. And the bottom line is that, you know, our patients are better for it.
Yeah, and with that comes certifications. There are different trainings and different ways that the team that you have that's working with this technology is making that happen.
Absolutely. Our nurses, I would say more than half, probably 60-70% have certified rehabilitation registered nurse certifications, which are certifications that are specific to rehabilitation nursing. We also have our therapists that have advanced certifications in various different areas. So these folks have gone through not only their training to become therapists and nurses, but beyond that.
So, Mary, we mentioned the multiple locations and the moving and shaking. You have a new hospital on the horizon.
We do.
This is big.
This is huge. This is huge. We have a joint venture with VCU Health System. We'll be combining our 2 hospital beds and the VCU beds, and we are building a brand new state-of-the-art 114 bed, about 188,000 square foot rehabilitation hospital.
Wow.
It will be located at Broad and 288 in the West Creek area. It's a gorgeous piece of land. It's elevated. We're working with the designers, the architects, and the general contractor now. We've got about 100+ people working on 17 different teams to give input to the architects and the contractor. And really this process is going to take till April before we kind of work through the design of this hospital. We're getting staff input, so they're going to be the actual people who are on the floor working with the patients, looking at workflows, looking at efficiencies, what's best for patients. And by April, we should have our final plans.
Well, this team is going to be invested in that space. We have like 30 seconds left, and we mentioned the Active Aging Week, September 25th through the 30th. You have free classes for everybody to come in and enjoy.
Right, we do. And we're really happy that you're able to promote this for us, and we'll be looking to provide those kinds of classes for folks. And we are a resource to our community, and we want to continue to provide those kinds of resources. We do that really anyway. We have various different classes that we provide, but we're very happy to participate in this program too.
Thank you for all you do, and congratulations on the new space.
Thank
That's
you
going to be
so
big. I have a
much.
funny feeling we'll be seeing you again
I hope so.
round about that time.
You bet.
There are a number of Sheltering Arms rehabilitation centers throughout the Richmond area. Find the location closest to you by giving them a call, 1-877-56-REHAB, or by heading online to shelteringarms.com.